Moving on, we move on to carbon fibre dynamic foot orthosis without the anterior shell for drop foot. Now we have two models here which look similar. But the clever touch on this is that we have a medial strut and a model with a lateral heel strut. The reason for that being, sometimes when you have a medial strut, you've got some overpronation and the strut could potentially get into difficulties with that, in which case you can use the lateral strut. Equally, you could have some oversupination issues that you're trying to control as well, and you can use the medial strut to assist that and overlay with wedging or foot orthotics if you felt that was appropriate. It's a fixed arm height. It doesn't really need to be gauged up any further than this, because the shank height has been gauged to suit the foot plate length, and it comes in a range of sizes from small to medium to extra large to cover all those sizes, and the shank height would develop up accordingly to suit that. The top shell again is a comfort liner that fits into the brace and again is removable for laundering. There are replacement kits for the padding and strapping that goes with the brace itself. That's an extra cost, but in many instances, of course, the strap and brace is very robust, which can be altered on a tab adjuster. So the length of the brace, once you've decided where the Velcro actually wants to marry up and finish, you can tab down and trim down the strap and seal it off with the tab to achieve the desired length of the fastening itself. I'll not trim this now, of course. And that would then form the closure on the anterior section of the calf for the patient. Both are the same strut design for the model. All the difference is effectively largely is the fact that the strut has moved from medial to lateral for the reasons that I've previously discussed. There are many indications for use of this, again similar to the previous AFO, main one being you're wanting medial-lateral hindfoot stability with drop foot control from that, so you can help with stroke patients, spinal cord injuries to some extent on these, drop foot from any neurological deficit going forward. The contraindications would be, unless you're using them with potentially orthopedic footwear and custom foot orthotics, to alleviate that, we've used these with Chopart type amputations for diabetics, but you do need to ensure that that has not got too much variable edema, because all the braces, of course, are non-heat adjustable over the carbon segment arms. You couldn't adjust those, so you have to ensure that that edema, the variable edema, if it's anything over a moderate level, is controlled, and then you can utilize other additional orthoses to add to these to cover a wide range of diabetic condition and modify it with foot orthotics, with toe blocks, with orthopedic footwear to fit all together, so that you've got a very dynamic toe off assist with the actual brace itself.